Good evening, everyone. How are we doing? Welcome back to Nurse Brainy Academy. Please notify me. Can you hear me? Notify me. Can you hear me? Can you hear me? Can you hear me? Okay. All right. So today we are going to discuss on a very important Viva. Why we are taking these Vivas is because of the May candidates. So I want them to be uh, well prepared, while our other discussions will be in Telegram. Now, today we are going to discuss on the Viva of the hands. But before we start our class, we acknowledge God and we give God Almighty all the praise. Now, quickly, we are going to explain. I want us to write down. Make sure you are writing. Make sure you are with your notes and you are writing. And if you are understanding, you notify me in the comment section. Now, today we'll discuss on the bones of the hand. Many students are being given this bone and they will start fidgeting in the hall. By God's grace, after tonight's class, it will be well simplified. So, without wasting much time, let us dive into the discussion. So, the bones of the hand are 27 small bones forming the framework of the wrist, palm, and fingers, providing support, movement, and precision grip in the upper limb. I come again. The bones of the hand are 27 small bones forming the framework of the wrist, palm, fingers, providing support, movement, and precision grip in the upper limb. So I will explain. This is what many students classify as the hand, but I will explain. Let's just continue. Now, what are the function of the bones of the hand? Number one, to provide framework and shape of the hand. Number two, to support the wrist, the palm, and the finger movements. Number three, to enable flexion, extension, abduction, and adduction. I believe you all know this, what they mean. Number four, they allow grasping and fine motor skills to hold something. Number five, they act as an attachment site for muscles, tendons, and ligaments. Number six, they protect nerves, blood vessels, and soft tissues in the hand. Number seven, they assist in power grip and precision grip. Now, what are the classification of the bones of the hand? After this, I will quickly explain how we should practice the procedure during the exam. What are the classification? We have the carpals, we have the metacarpals, and we have the what? The phalanges. We have the carpal, we have the metacarpal, and the phalanges. Please, are we together? Notify me. Can you hear me? Are we together? Notify me. Can you hear me? All right. So, what are the carpal bones? What are those that are liking? I'm impressed with you. God bless you. Shows you are following. Those that just liked, I just saw it. I'm impressed. Now, what are the carpal bones? we have the scaphoid, we have the lunate, we have the triquetrum, we have the pisiform, we have the trapezium, we have the trapezoid, we have the capitate, and we have the hamate. Carpal bones, I come again. We have the scaphoid, we have the lunate, we have the triquetrum, we have the pisiform, we have the trapezium, we have the trapezoid, we have the capitate, and the hamate. These are the carpal bones. I will explain. I want you to write down. Let me name them again so you write them down. Number one, scaphoid. Scaphoid is a bone. Scaphoid. Number two, we have the lunate, like a moon, lunate. Number three, we have the triquetrum. Number four, we have the pisiform. Number five, we have the trapezium. Number six, we have the trapezoid. Number seven, we have the capitate. And finally, we have the hamate bone. Make sure you're writing. Then we have the next classification as the what? The metacarpal. And the metacarpals are 5 bones in number. 5 bones in number. The metacarpal are 5. The capitates are 8 in number. The metacarpals are 5. The capitates are 8 in number. So we have first metacarpal, we have second metacarpal, we have third metacarpal, we have the fourth metacarpal, we have the fifth metacarpal. And the fifth metacarpal is the little finger, the fifth metacarpal. Then next, we have the phalanges. And the phalanges, another name, the layman name for the phalanges is the fingers. Okay, someone said I should zoom it. Okay, now we have what? Phalanges, which is what? The fingers. Which is what? The fingers. And we have what? 14 phalanges. The phalanges are what? 14 in number. The phalanges are 14. The number one metacarpal is the thumb. Then we have the next metacarpal 2, we have metacarpal 3, we have metacarpal 4, we have metacarpal 5. Today's class will be short but really blessing. Now, this is your thumb, metacarpal 1, the first metacarpal. We have metacarpal 2, we have metacarpal 3, we have metacarpal 4, we have metacarpal 5. These are your carpal bones. This is your ulna. This is your radius bone. Then after the ulna and the radius, we have the what? The carpals. After the carpals, we have the metacarpals. Then we have the phalanges. Then in the phalanges, we have what we call the proximal phalanges, we have the middle phalanges, and we have the distal phalanges. Now, in that bone, we have the joints. There are joints in between these bones in your hand. Now, number one joint is the intercarpal joint. Number two is the carpometacarpal joint. We have intercarpal joints. Number two is the carpometacarpal joint. Number three is the metacarpophalangeal joints. And the last one is interphalangeal joints. Now, the intercarpal joint connects the carpal bones to other carpal bones. Intercarpal, from the word inter, just like international, between two countries, interstate, between two states. So intercarpal, joining a carpal bone and a carpal bone. Carpometacarpal, joining a carpal bone plus a metacarpal bone. Metacarpal phalangeal joints joining a metacarpal and a proximal phalangeal joint. Interphalangeal joints joining two phalanges, a phalanges plus a phalanges. The joint there is interphalangeal joint. Are we together? While I'm reading this, I want us to write first before explanation. So are we together? Notify me. Are we together? Are we writing? Because this is Nurse Brainy Academy. I'm not here to just rush it for you to just go and do your Viva, but you are in nursing to save lives tomorrow. You are in midwifery to save lives tomorrow. So when you know all this at the tip of your finger, you will be able to do well in your profession tomorrow. And by God's grace, I'm trusting God that all of you will pass your exams. Make sure that your ring are signed. Make candidates. Make sure your rings are signed. Make sure you know your projects very well. Now, let's continue. So these are the joints in the hand. So this is the carpals, the carpal bones. These are the metacarpal, and these are the phalanges, otherwise known as the fingers. These are the metacarpal, and these are carpal bones. Now, looking at your hand, your physical hand, this middle here is the metacarpal. From the word metacarpal, the M, the middle, M standing for middle. The M is the word metacarpal. In between here is the metacarpal. You can even feel it, and we can count it. Let's count. Metacarpal 1, the thumb, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. For being in this academy, you should know where the, if a patient comes, you should and says here that he or she is feeling pain here, a subjective pain in this area, you should know the bones that are there. We are not going to discuss the muscles today, so but I want you to know the bones before I tell you how to do in your Viva. So these are this middle place from the word metacarpal, the M, middle, standing for M like a middle, metacarpal. And like I said, the thumb is the first metacarpal, metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. Then below here are the carpal bones, the bones that are connected to the ulna and the radius, the carpal bones, the carpal bones. Then the middle here is the metacarpal. Then these fingers is what? Phalanges. And the phalanges are how many in number? They are what? 14 in number. 14 phalanges. We can count it. There are 14 what? Phalanges. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Those lines in your hands are the ones that separate it. Then for the metacarpal, 1, 2, 3, 4, 5. The only one that are beneath that we can't count because of its articulations are the carpal bones. Please, are we learning before we go into the Viva? Are we learning? Notify me in the comment section. Can you hear me? Are we learning? Notify me. I want to see your comments. Are we learning? All right. So we have learned the identification with our physical hand. Now, let us quickly dive into the Viva and more explanation. Now, many students and many nurses and midwives call this the hand. This is not the hand. This is the upper limb. It's only this place, this area is the hand. This is what? The upper limb, where we have the scapula, we have the clavicle, we have the humerus, we have the radius and ulna, and we have the hand. So for being in this academy, number one, for being in this academy and in tonight's class, you can identify the bones of the hand, even at the physical flesh you can see. And number two, you should note that this is not the hand. Only this area is the hand. Others altogether is called the what? The upper limb, where we have the arm, we have the forearm and the hand. I don't want you to call everything the what? The hand. We have the arm, we have the forearm, and we have the hand. The hand constitutes of how many bones? 27 bone. And it can be classified as what? Carpals, metacarpals, and phalanges. Are we together? So, number one, the bones are what? 27 in number. What are the carpal bones? Now, in your Viva, before I give you an Osborne shortcut, in your Viva, you are expected to call these bones, especially the carpal bones. So I will